You all come back next week, same time for that. Okay. Bye.
All right, thank you, Sam. Yes, we're also clapping for her. Welcome to the harm reduction training. I am so glad that you guys are here. This is something that is near and dear to my heart, and I just think that education is like the backbone of harm reduction and doing what we do. So if one person shows up, I'm pumped. So yeah, I just appreciate you guys coming. So I'll do a little thing about myself because Sam can't switch it. Basically, I started this harm reduction SSP in about January of 2023 and applied for to be a syringe service program through the state and got registered, and then found a fiscal sponsorship through Open Collective Foundation. So yeah, now I look for grants and I fundraise. Right now we're fundraising for a van so we can do more mobile outreach, but that's basically where we're at in the fledgling days of a syringe service program. So just going over the basics. What is harm reduction? So harm reduction is a set of, and all of these definitions are from the National Harm Reduction Coalition, which, have been worked over by so many qualified people that usually the language is the best to use. So first off, it's just a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. And also, it's a movement for social justice based on a belief in and respect for the rights of people who use drugs. And it sounds like something super basic, but it's actually like continuously applying throughout history and including today. And I also wanted to include the definitions by Maya Salovitz. She wrote the book Undoing Drugs, which was the first actual historical account of where harm reduction was born. And I just love the way that she puts it, that it's an understanding, a way of understanding behavior and culture that has a relevance far beyond drugs. Harm reduction is an important guide to all types of policy. It's really a philosophy for living. And not even bullshitting, I actually really have adopted this in my life. It has changed the way that I view people. It has I think opened me up to being a more understanding person, and I just think that it's so important. And she also says, in essence, harm reduction is radical empathy. The basic idea is that regardless of whether people continue to use illegal drugs or engage in other problematic behaviors, their lives have value. And this comes into play a lot later, but basically what harm reduction is loving and accepting people that are making decisions that you don't necessarily agree with, and that maybe are obviously harming them, but it's also respecting their ability to make those choices because they're a person, and They deserve autonomy just as much as the rest of us. So I'm just going to kind of go really quickly through these because they're a little bit wordy, but also really important. So I just want to include them quickly. And these are also the National Harm Reduction foundational principles of what harm reduction is. So it accepts, for better or worse, that illicit and illicit drug use is part of our world. I think we're far past denying that, not in my house, not in my neighborhood. It is absolutely everywhere, and we just need to accept that that's a fact. We understand that it's a complex, multifaceted phenomenon that encompasses a continuum of behaviors that range from severe use to total abstinence. And a lot of people kind of misunderstand harm reduction as not including abstinence, and it absolutely does. So it's just a whole continuum of behaviors depending on the person and what they need. And then number 3, it establishes a quality of individual and community life and well-being that doesn't necessarily include cessation of drug use. And that is just kind of down to the phrase like community is the opposite of addiction, and really like bringing people together in a community, and not like coercing them into not using drugs. It just has a positive impact on people and relationships. And then number 4, it calls for non-judgmental, non-coercive provision of services and resources to people who use drugs. And like, again, it's talking about the coercion, and I do go more into this in detail, but it's that, well, you can only live here if you maintain complete abstinence. And so they're holding like lodging over your head, they're holding your freedom over your head. Maybe you have to go back to prison if you violate. Like, it is inherently a coercive system. And then number 5, it ensures that people who use drugs, and those are the history of drug use, routinely have a real voice in the creation of programs and policies designed to serve them. This can be kind of like shortened into the phrase, nothing about us without us, which came from the disability movement, and just makes a statement that if we're creating these policies for people, it is 100% necessary to include the people these policies will apply to in the conversation, in a real way, and not maybe just like catering to them but not really using it. It's the most valuable information a lot of the time that you can get, but unfortunately doesn't always happen that way. And then number 6, it affirms that people who use drugs themselves are the primary agents of reducing the harms of their drug use, and seeks to empower people who use drugs to share information and support each other in strategies. So, this is based on even like how harm reduction was initially spread by word of mouth or by zines or by, small community centers. It just like the people who are actually out there and interacting are going to be the best representatives of what it is. So like, by continually educating people, you're then sending that person out that's going to educate more people. and it kind of has like a ripple pattern effect. So really, like, by educating someone who uses drugs, you're possibly not only saving their lives, but like if they're using with a bunch of people and they're like see someone that maybe is like about to use a used syringe, like, hey, no, like, why don't you have one of my new ones, or like, I know a way to bleach it. It passes on naturally. So next, number 7, and this is maybe one of the most important, is that harm reduction recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequities affect both people's vulnerability to and capacity for effectively dealing with harm. So for all of these reasons, people might appear combative to help, or they might just seem stubborn, or like, why can't you just get it together, or like, don't you want to blah blah blah. All of these things are holding people back, and it takes a lot of work building up trust with people that they can maybe like finally open up about this stuff. And like, it's you have to like recognize that that's a reality, and often like holding people back in a really major way. And lastly, it just doesn't attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. So in no way does harm reduction advocate for drugs. I mean, particularly with the supply that we have right now, it's almost like I feel bad for kids nowadays, because like, I was able to have an experimental phase, and I never had to worry that there was this killer like cut in, like, it's real and it's harmful, and it's taken a lot of our loved ones. I think the number right now is 109,000 people. So it's just an unacceptable amount of people. I'll leave it with that. And I'm also going to go into liberatory harm reduction, which is basically the same thing. It just kind of expands upon what the National Harm Reduction did, in including other things other than drug work, like sex work, survival work, domestic violence, disabilities, that kind of harm that's brought on them, and how we can alleviate that. So I'm going to just say LHR for the sake of time, because it's really long. But it's just another set of tools based in a liberation movement on, complex relationships, and chosen family, and just, being able to acknowledge again that this country and the system would, rather see us dead than, to rise up. Becoming a statistic is a real thing, and a fear. So we're trying to empower people out of that. And also Micah Hobbs Fraser, who was one of the first founders of LHR, and she said, in this work, let's get underneath and get to the root cause of things. Because if we don't get to the root of things, you're constantly responding and putting band-aids on stuff. instead of like creating these like long lasting solutions. So instead of just responding to crisis and violence and harm and trying to mitigate it as you go, LHR can pull out the roots and then plant something different. And, you know, identifying it. Is it white supremacy? Is it patriarchy? Is it your trauma? What allowed and supported this risk to happen in the first place? And that's really what the work is about. And I just love that because, yeah, it's about condoms and safe rigs and smoking pipes, but it's also about challenging police violence and how that harms people. And it's about challenging the medical industrial complex and how that harms people. And you know, just these big complex systems that cause a lot of harm. And I also wanted to include in here the Indigenous for-fire model of recovery. And it's a little less known, but I just thought that it was really lovely. So I wanted to include it this time. And it's based off this concept of like a circle with the fire in the middle. And it includes things like cultural safety, reclamation, self-determination, and sovereignty. And a lot of these concepts are applicable to Indigenous people. But it also includes a lot of things that are applicable to all people on the front lines, like power differences that exist between service provider and the client and patient. And, you know, it's easy to write like a manual or, you know, I've gotten my CRSW and like taken a test on this stuff, but it's very, very different when you're dealing with these situations. And I think it's, you know, it's important to acknowledge that power differential and creating space for Indigenous people, and identifying colonialism and how it's kind of distorted a lot of these communities. And also non-interference, you know, is part of the sovereignty, but it's something that isn't really talked about a lot, and it's sort of associated with the white savior complex. Like you want to jump in and fix things for people, but it's not really your place to fix things for people. It's about empowering people to be able to fix themselves. So sometimes you just need to learn when to shut up. Like, honestly, like, just come back the next day. Like, if that person doesn't want help, they don't want this or that, come back later, check on them, and, you know, just, like, respect that person's autonomy. And, yeah, don't try to save people. It's so corny and not great. And also this, like, really great quote that I got from here, and it's sort of hard to read, so I'm sorry, but it's part of like the incarceral system, and I'm gonna talk again about this later, but court mandated treatment is not the answer to everything. And, you know, I've worked with a lot of people who are coming out of Stratford County and re-entering life, and it was just kind of, I mean, watching people not have access to shelter or basic needs and asking them to stay straight because it's mandated by the court is just like the stupidest reason you can ask people to stay sober. It's kind of just like a farce that people are forced to play along with. But like, especially if those treatments don't support people where they're at, like requiring sobriety or non-use all of the time. A lot of the times requiring sobriety is actually like putting people at direct risk, because sobriety is not for everyone. And like, I think a lot of the times when people seek sobriety out of guilt or out of feeling like they owe it to someone, like a lot of the times, like it will break, and unfortunately, that's a lot of times when overdoses happen. So, you know, and sobriety for sure has its place. Again, a lot of people benefit from it and need it, but it's just not for everybody yet. And it's also just, you know, it's possible to not always reduce the amount of substances used by identifying and knowing what kind of behaviors and consequences are harmful. So like, it's like taking the subject of the problem from the substance to the behavior and actions around the substance that are like negatively affecting your life. And like, if you truly believe that it's only a result of the substance, then that's the answer. But a lot of times, like even me personally, like I knew I was like self-medicating a trauma and not dealing with it, and it really wasn't about the substance I was using. It was kind of just about pushing down that trauma, which a lot of people do because it's a great survival mechanism, honestly. And then we're going to go a little more into like the history of harm reduction, because you can't really date indigenous practices. We really have no idea how long that they've been happening, unfortunately. But in the 70s, we had this great revolution with the Young Lords. They started an acupuncture program, which continues to this day.
Where is this?
So this was at Lincoln Hospital. They actually took over the hospital and were operating out of it for a while.
Where's Lincoln Hospital?
In Manhattan.
Okay, thanks.
Sorry, I think it was in the Bronx, I want to say.
Cool.
Or maybe Harlem, but yeah, since then it's been torn down. But you know, basically like early on they were able to like identify that like people needed a gentler detox, and they were really early ones to use like medicated assisted treatment, and like acupuncture was part of that. And they knew also that the medical industrial complex was not treating people of color, Black people, appropriately, and so it was necessary to create a big action like this. And then in 67, we have the Black Panthers program, the People's Free Food, and they also advocated for free healthcare, free education. These are all early seeds of harm reduction and mutual aid, building communities, building support where there's economic disparities, and really just like bringing empowerment back to people who are extremely disenfranchised. And I just wanted to mention this gentleman, Fred Johnson, who is a former incarcerated person, and he worked kind of in the community of drug users. He worked in syringe access, and I just really appreciated this quote by him. He said, "For LHR to happen, we minimally have to understand that the master's tools," and in this, like, he's referencing, like, you can't, like the master's tool, you can't rip apart the house. Like you need to change everything up. So you can't use the master's tools, in this case the public health system, because it's not liberatory, and LHR must pull back from formal systems, listen, invest, and nurture in people of all ages, underground economies. This includes like underground safe injection sites, which exist everywhere, or even like underground exchanges, without judgment about who they are and where they want to go. And this really like involves kind of how harm reduction has evolved, and now there's kind of like an OG crew, and then there's like this newer generation who's kind of like battling to take the reins, and it's very typical, I guess, of any industry. But then, of course, we have the 70s, feminist activism for reproductive rights. Again, another seed of harm reduction, bodily autonomy, which constantly comes up in almost every way. And this was a huge part of bodily autonomy, is being able to choose. And then in the 80s, we had ACT UP, or the AIDS Coalition to Unleash Power, which I absolutely love that acronym. And they were the grassroots organization that worked to improve the lives of people with HIV and AIDS with direct action. They're actually kind of the masters of direct action. I mean, they really used artwork, they used music, they put on plays, they really just made an art form out of protesting this complete lack of acknowledgement that HIV and AIDS were spreading and weren't only affecting gay men, but also injection users, and a lot of times weren't even telling people who are injecting that it could be spread that way. Became very important. And then we have the first needle exchange spring up in Cali in '88 called Prevention Point in San Francisco. It was an all-volunteer, street-based operation. Again, this is like the grassroots level where all legit things in harm reduction exist. And like, I love this little story, but like at the time, it was still illegal to carry syringes. So they would like go down like a stroll or an area where like sex workers would gather, and they would put all of these syringes into baby carriages and like cover it up. And that mental image I find to be really funny. But they also not only spread that awareness of safety, but they also partnered with researchers and collected data to document health benefits of syringe access. And that's really what put harm reduction on the map, because once you start producing data and you can show results, typically that's when you can persuade more people that like this is a solution. Although, I mean, the data right now is so obvious for harm reduction, but we'll see what happens. And then next, I just wanted to cover another OG, Dan Bigg from Chicago Recovery Alliance. He was co-founder in '92. He was called the Harm Reduction Godfather. He began syringe outreach again when it was illegal. he coined this term, recovery is any positive change, and that was like the beginning of like radical acceptance of people and their choices, and like anything that people change that makes them feel more positive about themselves is progress, is recovery. Like, you're doing the work. Like, and these can be things like going from injecting to maybe smoking. That's freaking huge for someone to do. So it's like acknowledging that small steps can be made, and like you don't have to go through the agony of like the withdrawal that like our traditional systems have promoted, because it's just not fair to ask people to do that. Really, it's like torture. Dan Big is also much beloved because he was instrumental in the normalization and accessibility of naloxone outside the MIC. That's another acronym that I'm going to use. It just stands for Medical Industrial Complex. So, like, he was the first guy that was really, like, running around on the street and Narcaning people, like, using the intramuscular naloxone when people had no idea what it even was. And he sort of, like, normalize it into what it is today, which is like a much, like, a very well-known medication that most people are aware of. Like, he was part of making that a national thing. And then next, I'm just going to go briefly over disability justice and harm reduction. This is something newer that I've added on. I myself am disabled and have recently started calling myself, self-identifying that way. This is kind of like close to my heart. And so I found the best definition of disability is by this organization Showing Up for Racial Justice Caucus, and they say, when we speak of disability, we are celebrating the brilliance and vitality of a vast community of peoples with non-normative bodies and minds, whether a disability is visible or not. This includes, though is not limited to, folks who identify as disabled, chronically ill, deaf, mad, neurodivergent, and more. And obviously, more and more have been added on to that as knowledge has increased. But it's just, it strives to be an inclusive definition for people. And it's also, but it's inherently, disability justice is anti-capitalist and anti-colonialist, because throughout history, disabled people have sort of been pushed to the sides. They've been viewed as burdens. Problematic bodies was something that I thought a lot about as someone with Crohn's, and just the way that, you're referred to as like a body that is not working, like a problem that needs to be solved rather than like a whole human. So disability justice is like about re-empowering people to redefine what well and healthy is for themselves. So, in these communities, being cured or becoming able or normatively bodied or minded is not the primary goal. Living better on our own disabled terms with autonomy is the goal. And that's where it links up with harm reduction. It's about making your own decisions and making your own definition of what like freedom is for you. Like, whether you have substance use disorder, whether you're disabled, whether you're a sex worker, like, you get to define what is important in your life, and like, really, like, fuck anybody else who can't deal with that. Like, you decide what you get to do. And I think that's something that a lot of people like don't get to hear enough. And that applies to a whole bunch of people. And just a few things. What's really important about disability justice is recognizing the medical industrial complex is a source of harm. I know one participant that I worked with at the syringe service program who is a longtime user, and she went to the emergency room because I think she had like bronchitis. She has some kind of infection, and a cap of a syringe, which are orange, fell out of her bag, and they said, either let us search your bag or you have to sign out against medical advice. And so she signed out against medical advice and didn't get the medication she needed. And like, there's no reason that really needed to happen. And there are a lot of people who use drugs who would honestly rather die than deal with the way that they're treated by medical staff. And it's tough because, you know, you can see the frustration from both sides, but really it's just a miscommunication of what's going on, and also stigma and like just lack of understanding that's happening. And also, just a quick example of this, also for harm reduction, is this thing where chronic pain patients are now stigmatized as med seekers. And probably all of you guys have heard this term. I think literally after I had a C-section when I was pregnant, when I asked for pain medication, they called me a drug seeker. So like, it is crazy. And also a lot of people who are suffering from the Adderall shortage right now, they're being told by their doctors to call from pharmacy to pharmacy to see who is stocked up with that medication. But that also goes on their record that they're calling different pharmacies, and that labels them a drug seeker. So like, these like new stigmas that are like terrible leftovers from the opioid epidemic that was a result of corporate greed, not people being bad people. But anyways, next I wanted to kind of go through the punk movement and their contribution to harm reduction. So harm reduction is kind of like a group of weirdos and outcasts, and it's kind of fun. And, you know, like, I read in this book, you know, when the author basically asked a bunch of people to write small, like, articles. And so she said, when Shira asked me to write about what punk has contributed to LHR, my first thought was that it has something to do with the politics of resistance, made more sustainable through the somatic release of irreverent, glamorous rage, which is like, oh my gosh, love that. We laughed after breaking Chloe, who is the lead singer, out of the mandated psych observation at Bellevue Hospital until we cried, and almost all the toxicity, impotence, and rage at the medical industrial complex that had built up over the prior week was metabolized by glamorous punk irreverence. So, like, this is also something that, like, has helped me like in my recovery, but also like learning how to empower myself is like acknowledging anger and like acknowledging rage and like justifiable anger and like exercising those bad feelings and like being able, I think a lot of people are taught to like suppress feelings that maybe make other people uncomfortable, and I think it's really important for people to have ways of expressing that because it's so normal and so necessary for people to channel this energy into something. And like I myself like love hardcore shows because I love how it's like this communal space where everybody has decided that we're all gonna get our demons out together to very, very loud music, and like all is forgiven. Basically, like nobody's out to hurt anybody. It's just like we're all working it out together. And also like another reason they were important was that the Transistors, which was the band that Chloe was in, was one of the only bands that addressed issues around AIDS and had the courage to sing about their anger and to alchemically transform all the hatred and stigma around the disease itself. So again, it's co-opting this negative, like these negative stigmas that are put upon people and almost turning them on their head to like a power that you're able to wield. And I just had some of the lyrics that she had from her band that I'm not even gonna try to sing. And also just some other punk stuff. Again, in Saving Our Own Lives, she talks about, unlike the popularized punk culture of resisting middle-class suburban normalcy, which is probably how I got into it, maybe how some of you got into it, but this was a small group of anarchist punks that were connected to working class rage and solidarity politics. So in 1984, these guys up in the upper top left, they drew on the success of Rock Against Racism UK, which was like a music festival, and they formed the Rock Against Racism US collective as a response to the police state. And so like they were putting on these like punk shows about police brutality back like in 84, and like using punk music. And like another thing with this bottom picture here is like zines are so critical in like the passing of information, especially like before the internet came about. Like this, you know, guerrilla literature basically was, you know, has a lot of like amazing art, but also information that people are able to pass between each other. And there's also a whole program called Punks with Lunch. This is the original chapter in West Oakland in California, but there are Punks with Lunch programs all over the country, which do everything from mutual aid, like actually giving out food, to being syringe exchanges, and they're just rad. I love them. So let's talk about SSPs, or syringe service programs. So this is what Insubordination Station is. So they are associated with an estimated 50% reduction in HIV and HCV incidents. And this is give or take. A lot of the stuff that we talk about is preventing the spread of infectious disease. So we're constantly saying, don't share needles. We also have like mouthpieces for pipes. Like, you're just encouraged not to share anything that would allow that spread to happen. And they also serve as a bridge to other health services, including testing and treatment, and maybe like medicated assisted treatment. Like, say you come in one day and you're like, I don't want to do this anymore, I want to try Suboxone. Like, you know, working with peers, you know how to make that happen, and like maybe how to like make that the most comfortable and supported like transition that you can possibly make it. And then, so again, the majority of SSPs offer referrals to MAT. New users of SSPs are 5 times more likely to enter drug treatment and 3 times more likely to stop using drugs than those that don't use the programs. And I think that this is simply because nobody's telling them that they have to. Like, I don't know how many people that like I served in certain service programs who by themselves were like, hey, this is the last bag that I'm getting. And like, you know, I'd do a little dance and it would be like a celebration because like nobody coerced them into doing this. It was like a decision that they made. So that's always what we're trying to do, is we're trying to prevent overdose deaths by teaching people who inject drugs or people who use drugs how to recognize, respond to, and reverse a drug overdose by providing training on naloxone, how to reverse an overdose. A lot of times when you're using drugs, you're using them with other people. Not always, but if you're being safe, hopefully you're using with other people. So teaching people who use drugs how to be able to respond in an emergency situation are going to be the most valuable people that you can teach that skill to, which translates again to how important it is to have people who are actively using drugs in these programs, because they know how to speak the language. They've been there, and like people can tell if you're bullshitting. Like people can tell like if you're some academic. So it's important. This is the whole thing of meeting people where they're at, like for real. So like this little thing that I kind of wanted to write out is like, when a person comes to access clean rigs without judgment, it restores a sense of control and autonomy that many people with substance use disorder lack. Like there were several people, and like I would practice this way of talking with participants where I would try actively to like remove any trace of judgment from my voice, which sounds kind of weird, but like multiple people would be like, nobody's talked to me like a person in years, or like nobody's talked to me like I'm a human being in, you know, so long. And like that was a revelation that I went through, that it's things so simple as just like being respectful, being compassionate, maybe joking around, like, you know, just like treating them like normal people and not like problems. So like if someone is making an effort to avoid sharing works, they're indicating that they do care about their health. And this is like a big misnomer that drug users can't possibly make any coherent attempts at doing things that benefit their health. But if they're coming in for clean rigs, they care about their health. They don't want to get any diseases and they don't want to spread anything. So like you have to like look at it from that direction. And this is contrary to propaganda from the war on drugs, again, that asserts that drug addicts are incapable of making coherent decisions. And this is like been talked about in the Supreme Court, that drug users are incapable of making decisions. Because of this, every person that walked into my old SSP or that I serve now, I think that every human being is so brave to access sterile supplies, even to like walk inside that building or to text me. Like, that is amazing to like be proactive about maintaining your health despite this like horrible compulsion that you have going on. And like, I try to treat every person that I serve as like, as I would a great friend. Like, I just try to like treat them normally. And I loved this quote, like, whoever saves a single life is considered by scripture to have saved the whole world. And like, I'm not particularly a religious person, but I love that concept because I feel like every single person that I serve, it is meaningful to me, and I know that it's meaningful to them, and it has this wider effect of kind of like filling that hole in my soul or whatever by connecting. So yeah. And just gonna go,
Let's break here.
yeah, that's
So
good.
it's 8 o'clock. Let's take a quick break and then we can come back to do the prints.
Cool.
Lights are coming on. Shield your eyes.
Ah!
Wow, I'm trying to.
Did you get my message? Yeah, and I responded. You didn't respond back. Okay, cool. I just want to make sure you saw it. I will answer you, I swear.
Oh, yeah. I'm in Ghana.
What's that?
I'm in Ghana.
Let's see, like, just on
Just on the other side of Blackwater Road.
I noticed, I've been following like the Facebook page for Run Green for a while, and I haven't actually been able to make time to actually attend an event here until, well, this week, so. Took a little while, right?
Took you a while time to work together. You gotta expect that sometimes. What's got you interested in
Hey Sam,
following the
you have,
Facebook page and then
you
something
have
else?
It's like,
you see that
Facebook
flyer
page,
that was going and had like
learning
all the
about
shops?
second
Yeah,
level,
so, okay, cool.
because,
Snap a picture of that
you
too.
know,
Yeah.
interesting stuff happening.